Hi, folks. John Laz is here with the Health Insurance Specialist, coming at you with another episode of the instructional video series, Health Insurance Simplified. And Health Insurance Simplified is an effort to demystify and decomplicate the subject of health insurance for both consumers and business owners. Today's episode is episode number 6, and the subject of the episode is how to determine the true cost of a health insurance plan. Now, the true cost of a health insurance plan, contrary to popular belief, is comprised of more than just the monthly premium. Okay, there are actually 4 components. Now, the monthly premium, as you know, is the amount you pay each month, or maybe you pay it quarterly or annually. But most people pay monthly. So it's the amount you pay each month, and you multiply that by 12, and you have the annual premium cost for that plan. But there are other factors to consider when determining the true cost of a plan per year, and the second is your deductible. And many of you are familiar with how deductibles work, but I'll break that down a little bit just in case you're not. There can be individual and family deductibles with a plan. Some plans just have an individual deductible, and a typical arrangement might be the individual deductible on a plan is $5,000 and the family deductible is $10,000. So let's say you have a family of 3 people. If 2 of those people in that policy are satisfied their deductible, you've hit the requirement for the family deductible, so the third person does not have to satisfy their deductible for that year. Okay? And deductibles can range anywhere from 0 in rare cases, clear up to 15,000, even more. The third component of the true cost of a health insurance policy is your coinsurance. And coinsurance is expressed in terms of a percentage, and it represents the percentage that you have to cover of your medical bills in that policy year after you've met your deductible requirement until the full coverage of the plan kicks in. So let's say you have a $5,000 deductible, and then you have 50% coinsurance after that. You pay the first $5,000 of your medical bills in that year, then your coinsurance kicks in. That means you pay 50% of your subsequent medical costs. The insurance company covers the other 50% until you hit what's called a max out-of-pocket, coinsurance maximum out-of-pocket figure for that year. Now, with some plans, that can be the same as the deductible. And then, on the other hand, some plans have an additional amount beyond the deductible that satisfies or that determines that max out-of-pocket. So you could have a deductible of $5,000 and then your coinsurance requirement up to a max out-of-pocket for that year of $6,150. So in that scenario, once you've hit that $6,150 in expenses for the year, then your 100% coinsurance kicks in, which essentially means that the insurance company is going to cover 100% of your eligible medical costs moving forward. Now, keywords there, keyword is eligible there, okay? And what they mean by that is that some medical costs are going to be covered and some aren't, right? And the ones that aren't are called excluded and limited expenses. So you always want to know what's excluded, what's limited, and also what's included in your policy. And you can find those details in your policy itself, as well as the compliance approved consumer brochure that you should receive either before you purchase your plan or after you apply for it. The fourth component of the true cost of a health insurance plan is copays. And copays are expressed in a flat dollar amount. For instance, a $50 copay for a doctor office visit. And what happens with a copay is you go in and you get medical services and you pay at point of service upon leaving, before leaving, $50 in that case toward your office visit fee. And then the doctor's office is going to send a bill to the insurance company essentially for the remainder of that bill, less any in-network discounts that might apply. So 4 components you need to look at when determining the true cost of a health insurance plan. Put all those costs together in a hypothetical year, and that'll give you the most accurate figure. And then from there you can both look at that figure and then also the features and benefits of the plan to make your best decision as far as the policy that's right for you. John Lazis, the health insurance specialist, signing off for now, and we'll see you next time.